So we have our data dashboards on our website. I'm going to go ahead and just share our website in the chat with you if you want to go ahead and follow along. I think that could be very useful. These are dashboards we developed for our quality improvement projects with our facilities in mind. Of we wanted to return the data they submit to us back to them in a way that is hopefully helpful. So starting from the home screen here, this is the VNPC home screen. If you hover over our reports tab, you'll see data dashboards. So we'll go ahead and click on the data dashboards. So here we have 3 dashboards. We have the SMILE dashboard with our perinatal mental health conditions, the EBDC SUD, which is evidence-based diet care for substance use disorder dashboard, and then also our MMRT, which is the maternal mortality review team recommendations dashboard. So I'm just going to start. I'm going to go give an overview of the EBDC SUD dashboard. This is the project we're currently implementing. So here is the home screen for the EBDC dashboard. You can see the different tabs at the top. We have home, our outcome measures, process measures, and structure measures. And then we also included our EBDC data letter. So I'll give that a click. This is what is shared with facilities. This is how we let them know how we're collecting their data and what we plan on doing with it. And this is in kind of an effort of transparency. But just keeping that there to remind everyone of what we're doing with this data. I have a quick overview of this EBDC project. We currently have 11 facilities actively engaged in reporting measures that are presented in this dashboard, and that we're hoping to evaluate progress and identify areas for improvement through these data. So we do have some primary goals here for EBDC. We're looking to improve the care for moms with substance use, and through that, our goal is to have 85% of patients with opioid use disorder who received or referred to treatment or recovery services. We're looking to improve the care of newborns exposed to substances prior to birth. So 50% of substance-exposed infants at EBDC facilities will have a discharge plan. And then eliminate the stigma associated with perinatal substance use and exposure. And here we're measuring that 75% of providers and nurses will be educated on care for SUD. So these are our goals for EBDC by the end of the project, which has a few more months left to go. We should be entering sustainability with this in the fall. And then I do still have kind of a quick definition for what we're seeing with outcomes, process, and structure measures. We've already covered that today. And then I did, this is kind of most recently added if you have looked at the dashboard before, but I included this link to a video that has some tips on reading run charts from the Institute for Healthcare Improvement. So I thought if you're ever looking through these charts and you think that you need a little more help understanding them, this kind of quickly runs through what can be seen in run charts. So start going over our outcome measures. So here we have our 2 outcome measures. We have substance use disorder, substance exposed infants discharged to parents, and then also substance use patients who received or were referred treatment. So I do want to call it this one. We can actually click the expand button to make it bigger. So here we have the percent of pregnant postpartum people with opioid use disorder who received or referred to recovery treatment services through this project. So we were actually seeing that facilities were really meeting our goal for most months. You can see the median is at 88%. So our median over the course of the project is still over our goal. But one thing we notice is that this has been kind of a difficult measure to be tracked by some of our facilities. So we kind of see a lot of volatility. This number can be rather skewed a lot by maybe just a few number of patients that might be refusing treatment. So that's what we're seeing with this downward trend here. That it's just kind of some of that high volatility between months. But we do encourage our facilities to look at this with their unique facility IDs. Each facility is given this unique code that only they know. So you're able to come on this dashboard and look at data pertaining just to your facility. So if you're reporting on this and this dip occurred at your facility, we would encourage you to understand what was done and if anything needs to be changed in your process. So then we can just go ahead and go back. We can see both outcome measures here. And then I want to quickly go over the process measures. So go to the process measures page. And this project, kind of intense, has 7 process measures. So we have % of providers and nurses trained on respectful and equitable care. That's the run chart I've already showed. Substance use disorder care training. This is our goal. I'll expand this real quickly. This one has had kind of some volatility, but we've recently started to see an upward trend in the last few months, getting closer to our goal of 75%. But our median for this project is at 44%. So we do still have some work to be done to reach this goal, and we're working with our facilities on the best ways to do that. And then another goal that we are grateful to have already successfully met is the % of substance exposed infants that are discharged with a discharge plan. So this is a measure that was created by the VNPC. We had one of our facilities piloting this for us first. We wanted to make sure this project was including the infant side of the data collection as well. So here we're able to see that for most months, we've kind of been around 70, 80, 95%, which is really good when we initially set our goal before launching this measure at 50%. So we're really excited to see facilities reporting this and reporting that they're doing well. And then other of these process measures, we have the % of patients screened for substance use disorders. This one has posed to be a little bit challenging. We've learned that not all facilities are kind of in their processes are allowed to screen everyone for a substance use disorder, and it's kind of it's been kind of challenging getting that implemented, and not all facilities want to screen universally. And then we also have substance use disorders who are patients with a substance use disorder who are given counseling for medication for opioid use disorder, substance use disorder recovery counseling, and naloxone counseling. But similar to the patients screened for SUDs, these measures can pose to be kind of difficult to track for our facilities, and that's why we're talking about how we can adjust in the future. We maybe don't need 7 process measures if they're not all going to be impactful to the project, that we really want to make sure we have some high value measures, even if there's fewer. And then on the last tab, we have our structure measures. So these are generally they're very telling for the project. So we're able to see facilities are reporting these structure measures on a scale of 1 to 5. So 1 means they haven't started yet, and 5 means they're fully in place. So it's not really a goal of the project, but we are aiming for all our facilities to be fully in place with all these structure measures. Kind of the essence of quality improvement is that if you have a structure measure in place and improving, a lot of times your process and outcome measures will follow along after. So we're seeing a lot of improvement with most of these. We have facilities working on patient event debriefs. resource mapping and identification of community resources that's been improving. And then general pain management guidelines is the first one that's real specific to substance use disorder. And this one has really seen kind of a steady upward trend since the beginning. And if you hover on these, it will give some more information. So here for pain management guidelines, for May, we're at 4.3, but we can also see that 66.7% of facilities have reported this to be fully in place. So 2/3 of our facilities are already at a 5 for this. And similar with opioid use disorder pain management guidelines, kind of showing that improvement. And then we also have a validated verbal screening tool shared with prenatal care sites. So this one we kind of see is showing similar trend with that process measure about universal screening, that not all facilities are implementing a verbal universal screening, and this is kind of more evidence of that. But so that was just kind of a quick overview of all these tabs, and we really encourage our facilities participating to filter by their unique ID code. So you can just look at your facility, or if you represent a group of facilities that are participating, you can look at the whole system at once by selecting all of the facility ID codes in that organization. And then I'll also go ahead and go back to the data dashboards. I'll give a quick overview of the Smile dashboard. So really overall the same exact structure. The Smile dashboard is for our Smile perinatal mental health conditions project that's currently in sustainability, but we were doing it previously. So overall same kind of description of the dashboard. Through this, we had 20 facilities reporting in May in May of 2024 when this project first started active implementation. And then at the conclusion, we had 21 facilities because we did add a few. And then we moved to sustainability last June. So we have seen kind of a reduction of data submission since that time. We have been collecting data on a less frequent schedule, but we still think this data can kind of show a lot of what was done with this project. So starting off, we have our outcome measure. So for this one, we focused on the percent of patients receiving or referred to treatment for perinatal mental health conditions. So this was a measure that was rather steady through the course of the project, and you can even see after sustainability began last summer, we've really held to kind of the same trend here. It's been really steady around the median at 62%. And same with the EBDC dashboard. Facilities are able to filter by their unique ID code that only they should know. And then here are process measures. We collected data on respectful and equitable care training. So this is the first half of that graph. The perinatal mental health conditions care training. So for nurses and doctors to be educated on perinatal mental health care treatment options, and then also perinatal mental health care patient education at the bottom here. And then again, the same thing with these structure measures. Facilities are reporting on a scale of 1 to 5. We do overall see pretty strong improvement. One thing to call out here, this is July of 24. We did not collect structure measures that month, so this isn't there wasn't a month where everyone suddenly reported all ones. That was where no data were collected. So there's kind of a dip in the graph there. And then while I'm pointing out our dashboards, it's not really related to our quality improvement projects as directly, but I do want to shout out our maternal mortality review team dashboard. Um, so this dashboard actually has kind of a summary of recommendations from the maternal mortality review team. So they review all cases of pregnancy-associated death in Virginia, and they assign appropriate risk factors and create recommendations for outcome improvement. So this kind of gives the VNPC its foundation for which quality improvement projects we want to focus on next, and try to implement those according to recommendations set forward by the MMRT. So we did provide a quick kind of run through of how different users might find value in this dashboard. So for example, if you're a provider, you're wanting to understand pregnancy-related factors contributing to the loss and how you might be able to improve that in your facility. So we would encourage a provider to look at like provider-defined categories of relation to the loss, and then they can understand which recommendations are related to them. And then we also down here, if you use this dashboard, we want to know from you how you're using it, how you think this dashboard could be better. Along with all of the other dashboards, we'd love to have feedback on how things can be better or improved. But again, here, kind of the same process. We have these tabs at the top. We also have the most recent maternal mortality review team report, which is a really great report put together by the VDH Office of the Chief Medical Examiner, where the MMRT team is housed. So we click on this tab for the MMRT recommendations. So we're actually able to see this dashboard is including 96 case reviews. So there were 96 cases reviewed from 2018 to 2022 with a number of recommendations made in that time. So we find that 43%, 43 were related to the pregnancy, 43 were associated but not related, 36 were directly related to the pregnancy, and 17 were undetermined. And this is where we're able to see the factors contributing to the loss. So this is kind of what I was getting at with the first page. If you're a provider coming to use this dashboard and you want to know what were recommendations made when there was provider factors contributing to the loss. So you could click on this and it'll filter everything else down. So you can just focus on provider, and those are things that you might be able to improve in your work. And then we also have what we created was these recommendation groups. So we grouped the overall recommendations into training and education, health services, other mental health support as the primary groups. There were over 200 recommendations, and we felt that these groups were the best way to represent all of the recommendations for use. We also have risk factors. So if there's any specific risk factors, like for perinatal mental health conditions, you might click on mental illness, and then you'll see recommendations for mental illness. So down here at the bottom, this is really the meat of this dashboard. Save the best for last. But these are recommendation summaries. So we have these recommendations have kind of all been summarized into these groups. So for example, substance use, this number is actually the number of recommendations. So there were 28 individual recommendations made by the MMRT over this 3-year period. And so we've summarized them into this one sentence that we think is more actionable. So for substance use, the recommendation is to establish a coordinated, stigma-free system that provides evidence-based care, consistent screening, clear follow-up and referrals, harm reduction support, and strong patient and community education for moms affected by substance use. So this being 28 is the most recommended recommendation, if you will. So this is kind of what directly led to us working on substance use disorder as our current project. So this is really fun to play around with. Again, like if you want to click on provider factors, here we see then if you're a provider, the recommendation most occurring for provider factors is quality improvement, kind of risk assessment for appropriate levels of care, CDC here campaign, which is focused on respectful care. So this is kind of something you can bring back with you as a way to see the maternal mortality review team recommendations and how they might be able to be of use at your work.